This baseball season, catch every game at Long Neck Sports Grill. There are 3 locations in northern Kentucky, Wilder, Hebron, and Richwood, each one of them very easy to get to. Each one of them has 4K TVs all over the place, and the sound will be on. Plus, no place in northern Kentucky has better wings, and there's also no more extensive beer selection than the one you'll find at Long Neck's. Long Neck Sports Grill, and by the way, when the weather gets warm, there's nothing like Long Neck's patio. Long Neck Sports Grill, stay late. Come often. All right, we do this on Wednesdays. We talk injuries. This time of year, obviously, a lot of baseball injuries, but we've got an NFL injury, a Bengals injury to talk about. Dr. Mark Yuhas from OrthoCincy's is with us. What we love about OrthoCincy's is they have specialists and locations all over the tri-state, and you never need an appointment, and they have extended evening and weekend hours at both Edgewood and Anderson. You can learn more at OrthoCincy.com. That's OrthoCincy.com. Dr. Mark Yuhas from OrthoCincy is with us. Frankie Montas, I think he dodged a bullet, and by extension, the Reds have as well. He took that line drive off his right elbow on Sunday. We all feared the worst. It looks like the worst-case scenario is not the scenario we are dealing with, but he's going to miss a couple of starts at least. He has gone on the 15-day injured list. He's dealing with a right forearm contusion. Let's begin by, I'm going to ask you to explain to me the different types and grades of contusions.
Yeah, absolutely. Well, thanks for having me, Mo. Those injuries can be, quite frightening to see because they happen so quickly, and you just don't know sort of the extent of the injury until things are evaluated. So a contusion is, another name for a bruise. And sure, a bruise sounds like a pretty simple thing, but depending on the location of a contusion, how much swelling there is, whether it's located near a joint, near other structures, that's kind of how we grade them. So there are some that are more severe than others, more mild, moderate, and severe, I guess you could call them. But it really depends on how much pain a patient's having, or an athlete, where they're located, and kind of, whether they're near a joint or other structures as well.
Is the timeline here, does that make sense? It's a 15-day injured list stint. Obviously, that doesn't mean he's going to come back in 15 days, but the prevailing sentiment is he's only going to miss 2 or 3 starts. Based on what you've seen and what we know, does that make sense?
Well, I think so. And, when we're trying to guide an athlete back with this type of injury, usually it is based on some feedback about how much pain they're experiencing as they start to, improve their, movement and their activity. I'm sure there'll be a progression of throwing and other things. And when you have bruising or a contusion, that involves swelling, and the structures that are affected are things that help us to move. And those structures require blood flow and increased activity. So it makes sense that we want the swelling to go down around those things before we try to move too quickly, or else you might end up in the same boat of kind of still having pain and swelling and kind of going around in a cycle that you don't want. So yes, that does make sense as far as the timing.
Is the treatment just simply rest? Or are there things they do between now and hopefully when he comes back in a couple of weeks?
I think the rest is certainly a part of it. And, there are the basic anti-inflammatory medications, icing, compression. All of these things can help to reduce swelling and inflammation. Therapists will typically offer some other types of, as we call modalities, but things that can help to get the swelling down. But rest is certainly an important part of it. And we like to distinguish rest. Sometimes that means not being too active with the forces that we use with that particular arm or whatever we're healing, but also we want it to move. So we want to move it, but don't use it too quickly, if that makes sense. No,
it totally makes sense. Let's talk about Ian Jabot, who is going to resume his rehab assignment in Louisville, which is really good. He is a guy that, they leaned on him heavily last year. He was shut down during spring training. The initial thought was this isn't serious. They put him on the injured list to start the season. The idea was he would come back maybe sometime the second week of April. He goes on a rehab assignment, and then he's dealing with more forearm discomfort. He gets a cortisone injection. He rests for a couple of days. He has started playing catch. They've sent him back to Louisville. The injury itself is being called something I've never heard of, a pronator strain. What is that?
Yeah, so the pronator is there are several different components to the pronator muscle, but it's a muscle in the forearm that typically it's a deeper muscle. It attaches near the inside part of the forearm as well and near the elbow. And it helps us to rotate. It helps us to rotate and move the wrist and the forearm in certain ways.
It feels like on a daily basis at the end of spring training, I was reading about guys with forearm issues. Just given the fact that these guys have access to sophisticated training, everything they do is so closely monitored. Is there something you can point to as to why we had so many of these late in spring training?
I don't think there's one specific thing. It's a hard question to pinpoint. I'm sure there's lots of heads that are coming together to try to figure that out. Every spring training, it seems like, there's an emphasis placed on ramping up appropriately, not overthrowing or not doing too much. And that's kind of at all levels of baseball. And I think that's certainly important, but that's been around for a while. I think the athletes are just continuing to get better and better and stronger. Velocity increases, the spin rate of the balls, and, specifically we were talking about the pronator and, the rotation of the forearm, that's putting more stress on it with breaking balls and spin. But all of those things lead to it, proper mechanics. Maybe there's some adjustments that need to be made, but I think that just the level and the demand of the throwing certainly plays a role. I don't know the perfect answer about why there are more injuries. I do know that after spring training, it typically, is usually increased, whether that's, just an increased demand that you can mimic it all you want in the off season, but you still have to kind of do the live batting, and that just tends to lead to some more injuries.
Dr. Mark Yuhas from OrthoCincy's is with us. One more red, TJ Friedl. We are hoping that maybe within the next 3 or 4 weeks we can see him back in the starting lineup. He suffered a non-displaced right wrist fracture during spring training, and they kind of ramped him down a little bit because they kind of felt like he was pushing himself, and he is ramping back up again. He is swinging again, and you read that they're trying to build up TJ's arm strength. What goes into that process?
Yeah, so I think that when it comes to the type of break, if we talk about a non-displaced, that's a well-aligned break or a fracture in the arm. So sometimes those are even hard to see on an X-ray. The body needs time to just heal the bone, but if it's in good alignment and X-rays and our exam shows that the bone is healing, then we start to progress some activities. Usually, progressing strength first starts with getting motion back. And our hand therapists will always say that. You really can't get strength until you get motion. So it's really important to first start the athlete or the patient with coming out of whatever brace or cast or whatever it is to start moving. And then as that starts to move more naturally, then we start to build some of the tendon strength, some of the coordination with some of those small muscles in the hand and wrist and forearm. And it usually comes along sort of in a natural progression after that.
One more. It's actually Sam Hubbard of the Bengals. So a guy who missed a couple of games in 2023, came back late in the season. He was not 100%. He had ankle surgery in the offseason. Reading this week at ESPN.com that the surgery was more severe, or the injury was more severe than was originally thought. And so the procedure he had tightrope surgery and a deltoid procedure. He is rehabbing well, on course to start training camp and the season on time. What type of ankle injury requires tightrope surgery?
Yeah, so the typically what we would refer to as a high ankle sprain most commonly are the ones that would require a tightrope surgery. And the tightrope is basically a device that's used to help to stabilize a specific ligament in the ankle. There's the fibula and the tibia are the main bones that kind of make up the lower leg and the ankle. And that device is most commonly used to kind of stabilize some of those ligaments that are in between those bones. It can be used to also augment or help support other repairs that are done with some of those ankle ligaments as well.
Does this timeline track to suggest that he'll be able to start the season on time?
Well, yeah, I think so. Usually, with these types of ankle injuries, and it obviously depends on severity, and each one is different, but somewhere between 4 and 6 months typically is about the right timeline, maybe a little bit less than that. But certainly, that sounds appropriate. Yeah.
Lots to discuss. Sure. Awesome insight as always. Dr. Mark Yuhas from OrthoCincy. I do appreciate the time. We'll chat soon, man. Thank you.
Thank you, Mo.
All right, that's Dr. Mark Yuhas from OrthoCincy Orthopedics and Sports Medicine. OrthoCincy, you never need an appointment. They've got specialists and locations all over the tri-state, and they offer walk-in orthopedic urgent care at a whole bunch of different Cincinnati locations and extended evening and Saturday hours in Edgewood and Anderson, 9 to 9, 9A to 9P during the week, 9A to 1P on Saturdays. You can learn more, OrthoCincy.com. You never need an appointment, which means it's more convenient and cheaper than going to an ER whenever you have an urgent orthopedic injury. Again, OrthoCincy.com. That's OrthoCincy.com. Hey, when you and your buddies are looking for a place to watch baseball this season, how about Long Neck Sports Grill? Each location has 4K TVs all over the place, so you'll never miss a pitch. The menu is so extensive that you can get something different every time you visit, and no place in Northern Kentucky has a better beer selection. There are locations in Wilder, Hebron, and Richwood, and when the weather is warm, there's nothing better than a spring night on Long Neck's outdoor patio. This baseball season, Long Neck Sports Grill. Stay late. Come often.